May due to the ongoing coronavirus situation that we're experiencing. Being Board of Health members, we have a responsibility to the community to not only demonstrate an example of how to social distance and how to take active steps to reduce the risk of transmission and infection, but we also need to make sure that we protect not only our health, but the health of the people that we come into contact with. Many members of our board are either physicians or dentists and social workers and people who work in the nonprofit sector. And so we come into contact with people, and we should not be taking unnecessary risks, which could increase the spread into our community. And so that is why we are meeting virtually. And I appreciate everyone's courage in meeting virtually and doing what is right for our city while we can still meet as a Board of Health, so we can support not only our health director, but what we can do to help support our city in the middle of a pandemic. Does anyone have any thoughts that they want to share before we start off and just take roll? Okay, seeing no one have any thoughts to share. Angel, will you please call roll?
She's grabbing it right now, just a second.
Okay. And the other thing I will say is that I do have a copy of the Open Meetings Act with me. And we have offered an opportunity for the public to participate and to get their comments heard.
Good.
Yeah, she'll be right here. She's just getting something off the printer.
I'm so sorry. No, that's fine.
Okay. Mr. Flowerday? Dr. Garcia? Here. Dr. Lloyd? Dr. Miller?
Here.
Ms. Kingsley?
Here.
Mr. Randa?
Here.
Ms. Jarrett?
Here.
Ms. Bleicher?
Here.
Mr. Bowers?
Here.
Ms. Burke? Ms. Holloway? And Mr. Tast?
Nope.
Okay.
Okay. We will go ahead and move on to the public session. I don't believe that we have anyone in the waiting room to come and testify. Jamie, is that correct?
I am going to check right now.
Okay.
It's clear.
All right. Thank you so much, Jamie. Okay, we will go ahead and move on to the department reports with an update from our interim health director, Pat Lopez. How are things going, Pat?
Good. Pretty busy. I just came back from doing a press briefing with the mayor, and Tom was on there, and we've been doing some work with the cultural center. So I don't know, Tom, if you want to share maybe a little bit about that, and then I'll go on and give some more report related to COVID-19.
Okay, thanks, Pat. I just wanted to share that the culture centers have been working together with the health department. The health department has been very, very, very useful to us, very helpful. Initially, we had a lot of questions that we came to the health department with, and we started with some training for all our staff members at the cultural centers, and then we were able to get some protective equipment for our staff members from the health department. And also, most recently, the concern was we needed some testing for the people we represent, but there was a lot of barriers that they were facing. So we put our heads together, and this Friday at 4 to 7 at Lincoln High School, there's going to be testing for the people that we serve. They are the ones that have various barriers, like they don't have medical homes, they don't have insurance, they don't have someone to give them referrals. So all that has been taken care of. And then if they are found positive, we have ways to make sure that they will have food so they can stay in isolation or quarantine, and also other essentials like personal care items. So basically anything that will help them stay at home, those barriers, we try to cover them all. And we are also working with, I was working with United Way and a few other agencies to make sure that if they have things like utility bills that may end up coming up that will make them want to go to work, we'll be able to see if we can assist them with those as well. So they can stay at home, rent and stuff like that. So we are working very hard to make sure that they're taken care of. And we are very glad for the work that the health department has done so far, connecting the community with testing, which has been really difficult. So today was another wonderful opportunity at the mayor's briefing where we were able to directly talk to the people we serve, various languages, and we thought it was very successful. And the feedback I'm getting from the staff members is that it was a wonderful press briefing. So thank you for the opportunity, Pat, and for all the staff members over there at the health department for all that you're doing to help the community and the cultural centers.
Thank you. It's been great to be able to work with the cultural centers as partners, and they've also done PSAs with the mayor's office to be able to share out into the community, to reach out to people in various languages and messages that are more culturally appropriate. So we're looking forward, working hard to get that testing open for this Friday. One of the things that we recognized is that for some of our families to be able to quarantine and isolate at home, we need to help them be as successful as possible. And that's what Tom was mentioning about being able to give them a care package and ask them if there are other resources, maybe providing some food and other assistance if that's needed so that they can successfully isolate and, like Tom said, stay home like they need to do. We're also working with the hospitals, every day we have a meeting with them. And I thought I'd just share with you, today our numbers are up a little bit, but we still have a very healthy hospital system. The governor only looks at that parameter in considering how COVID is reacting in our state. So he looks at the healthcare system capacity. So we have 47 COVID-19 patients in the hospital, and we serve several. I think I was talking to you that when we met last month that we serve many of the surrounding areas, and we've also gotten patients from other hospitals out west. But we currently, of the 47 COVID-19 positive patients, 21 are from Lancaster County, 26 are from other parts of the state, and 10 of them are on ventilators, and 5 of them, those ventilator patients are here in Lincoln. So that system remains positive. Tomorrow, on the COVID-19 dashboard, we should be able to, our plan is to provide recovery data and race and ethnicity data. So we've been working to collect that data and make sure that it's accurate. So that's one of our big pushes right now. Last Friday, we had Dr. Bill Johnson, a pulmonologist from the group here in Lincoln, come and talk, and he gave a great message at the press briefing and did a great graphic about why we should all be wearing a mask when we're out in public and what the difference it makes in controlling the virus and who gets infected, along with washing our hands and and being physically distant from each other. So that message is going to keep coming forward. The Medical Society is working with us, and they're working with us and another community partner that came forward to try and develop more face masks to have available. Duncan Aviation continues to make face coverings. And so we use those like with the cultural centers and others that need those in their 501c3 organizations. So that's part of what we've been doing. We're still working with the women, the families from the shelter, the People City Mission that have been moved to a hotel, and Community Action Partnership continues to work with them and trying to get them permanent housing. They've been moved up on the housing list. So that's been really positive. This weekend, we're going to be doing towards the end of the week, we're planning on doing some screening at 2 of our meat processing plants here, one for sure, and then the other one we'll do. Test Nebraska is at the Lancaster County Event Center. I think you've probably all been hearing about that. I think they're working through some startup bugs, and so we're closely monitoring that and seeing where we're at with that. But Brian and CHI continue to provide a strong number of testing in Lincoln, and that's really been very, very positive for us all. I think we completed 300 and some tests yesterday in the drive-through sites. The state asked if they could come and observe our drive-through sites to see how well they're working. And we're also giving the state our plan that we developed for the homeless population. We still have the quarantine and isolation areas at the mission. Still have men from the mission who moved out. We've moved out, so there's more physical distancing and a safer environment. And I pray every day that we don't have any outbreaks there, as well as in the prison system. But we have good relationships there as well, and people reach out and talk to us when something's coming up. We're continuously monitoring our group homes, our group homes and our long-term care and assisted living. So we're having some work that we're doing there right now with those situations. But otherwise, it's just a huge volume. We're still on a little bit of the upcline. You can see in the situational report that's still continuing to increase. So we're up today 18. We know we have tests out there we should be getting in. So, and the hard part today was we reported another death related to COVID-19, and that was our second death this week. So in the last week. So I'm going to stop there and just ask if you have questions.
But what's the age for the person who died? Do we know?
It was somebody in their early 70s.
70s, okay.
Yeah.
How does the, oh, sorry. How does this is Dustin, how does the Test Nebraska data and the sort of the data that's done at the drive-through clinics, are those sort of in separate bins, or are they kind of put together at some point?
They're in separate bins, and they notify the individuals from Test Nebraska. You know, Test Nebraska doesn't collect a physician's name or anything. It's supposed to come through to the local health department in a separate line item. We get different lines from LabCorp, all the other testing sites. So it's supposed to come in a separate report. Do you want to hear a little bit about antigen testing? I just listened to one of the doctors at the Med Center today that they're working with COVAX in New York on antibody testing. And the Omaha firefighters, 650 of them were set up to do had specimens collected, and they're working on the test results that should be available Thursday or Friday. So they were looking at, that's an RNA test, and the antibody part, there's still a question if the antibody really, if it's present, is it really an indicator of immunity or not? So there's still a lot we don't know, but remdesivir is UNMC, or what is it? Nebraska Medicine. Yeah, I still call it UNMC, just like I call St. E's. And but they do have remdesivir, and they were forming a committee today to be able to figure out how to distribute that to hospitals. And that's the one treatment that they found that can be really helpful for some critically ill patients. So our main outbreak sites continue to be up in Dakota County. I think right now, Dakota County has, they're a population of, I think, 23,000, and they have almost 1,500 positive COVID cases. Yeah, it's just, and it's all related to that meatpacking plant. I see Jackie's question. No, we haven't had anybody ill with the Kawasaki type illness, but we keep watching for that. And that's something we'll talk about. On Fridays at noon, we do a Zoom meeting with the physicians in the community. And Dr. Hansen, the president of the Medical Society, leads those meetings. So that's been really helpful to get information from them. PPE is still a problem. We don't have enough. You know, we're looking for more gowns. And so we have the Brock Schmuck, if any of you saw that in the paper, it's Tyvek that's still being cut and sewn.
So late reporting news on PPE. I indicated earlier today we're concerned on some glove issues, and then the gowns have been tricky for a long time. We did get a lot of gloves in, tens of thousands of gloves. So that's good. We've got a lot of gowns in. They're all small. So we're not quite sure how that's going to work, but sort of interesting.
So let's see. How have you all been doing? I see James Michael fairly often. At least talk to him.
I do have a couple questions, but I don't want to hop in before anyone else has a shot. Does anyone have any questions or thoughts or comments for Pat or for Scott?
Well, I just,
Oh, go ahead.
I just can say how thankful we are, for your leadership over there, all the stuff. You're all doing a wonderful job. We'll have to do something for you when we're done with this. I don't know what it is, but we sure do.
Give her life back somehow. It's gonna be hard.
And we got a lot of help at the Child Advocacy Center too, and making sure that we kept the staff safe so that the kids that needed to be seen with some emergency could be seen. And I've had some personal experience with Test Nebraska, still trying to get a scheduled appointment, but they've run out of appointments apparently, but now they're sending follow-up emails so you can try to sign up for another time each morning. So we'll see if that works.
Okay,
I second.
Do you need it to know?
Go ahead. Go on.
No, you go.
No, you go.
No, I was just going to tell Stacy, just let us know if you need a test before then, and you can always get in at Brian or St. E's. But I know they're saying that they opened it up for people over 65, and it somehow corrupted the whole system for a while.
The thing I was going to ask you about is the packing houses.
Oh,
And places where, well, this whole order where, people are ordered to go to work how are they handling that?
Well, we've worked with, we have the two places in Lincoln, and they've done a really good job kind of isolating their staff and following good protective measures. Some of those individuals, think about contact tracing, possibly they've been exposed to people from the other Smithfield plant. And that's where some of that comes from. But the numbers have, knock on wood, been really pretty low at the Tyson place and the Smithfield place here, the former Cooks. They have been wonderful to work with, and that hasn't really been an issue. Where our cases are coming from are the plant in Crete. And I think they were a little slow on putting some measures in place, but they're doing that now. Their production is down 50%. People that are ill are staying home, are being tested. They're still being paid. So we continue to work with them. We've almost gotten, there's 2,100 employees at that plant. Now, the plant in Dakota City, I think there's 4,100 people that work there. But this plant, we're getting close to having been able to almost test everybody at the place in Crete. Brian's gone out there several times, and the guard's been there as well.
Fantastic.
And they did have a site visit there's a team at UNMC that'll go out and give advice, but we actually have a playbook for, I think the new term for them is animal manufacturing companies. I'm trying to remember that.
Huh.
Yeah.
You know, they
That's
manufacture
weird.
also.
Yeah,
So-
it's weird.
What is the state doing? The state
Well,
health.
that's part of the state. Well, they're doing tests in Nebraska. They're managing the PPE that comes in to get it out to us. They've set up places for people to stay if they need to isolate or quarantine from home. They're basically, that's who we work with the nursing homes. There's a team from the state that they call it ICAP, and don't ask me what that means, but they're working with us on that.
They're service coordinators. They've trained the service coordinators to do that.
Yeah, and they also have they've trained, I think it's 300 staff to be contact tracers now.
Right.
And their goal is to get up to 1,000.
That's good. That's good.
Yeah.
Does anyone else have any comments or thoughts or questions for Pat or Scott?
Pat, you're awesome. Scott, you're awesome.
Thank you, Jackie.
Thank
James
you.
Michael, you are the bomb.
Only because of you. I have two different questions. And I should have asked this before, but I didn't even think of it. When it comes to Test Nebraska, how are they determining who gets tested? I haven't figured that out yet.
Well, what we understand is that you're supposed to go in, and they still are giving priority to like healthcare, first responders, long-term care. However, I don't know how and older adults that are more vulnerable, and then people with symptoms. But now they've opened up to the category of people over 65. So you go in and you do this online process, and it sounds like Stacy's done it. I went in and tried to do it once. We've had one of our staff people do it too. But then they send you a message and you sign up for a specific testing time within so many. They give you a time frame like 2 to 4. And then you get a QR code that you take out and show that to them, and then you get your test.
So if Test Nebraska starts testing people over a certain age who may not have been had an exposure risk or showing symptoms, is that going to change our positive test rate? And
Yeah. Mm-hmm. Yes. Because, you know, it's likely to drive down the positivity rate. But then we still have those other cases, you know, we're at like, I think I said 8.7 or 8.5 today for positivity. But it will impact it. That's a good question.
because
That was kind of why I'd asked about the bins. I didn't know if you're able to kind of sort out those groups.
Yes. We can tell by the test number, and then we can tell who's positive, you know, and the negatives. We keep track of the negatives to help us with the positives to determine the rate.
I'm just wondering how that will impact looking at next steps for Lancaster County, if the way that our positive test rates have been calculated, if there's a change to that through Test Nebraska.
I think we'll be able to keep track of it because we haven't gotten results yet for me to be able to say much, but that's something we're aware of. And also, you know, we're going to watch as our cases go up too. So that's another thing we're not going to quit. And the contact tracing and our bed capacity, our health system capacity. Those are all things that we're going to be watching. I mean, we want more testing, definitely. But we just need to make sure that we're vigilant about those other areas.
Yeah, the additional testing will help us identify other positives, even though it'll be a lower percentage, but we still need to identify those so we can do contact tracing and control the outbreak.
Yeah.
So we're all for the additional testing. Pat described it very well this morning, you know, that we support the additional testing for sure.
The second question I have is more along the lines of our first responders. And do you know if the health department is taking any steps, or if our first responders are taking any steps to keep them safe as they work in the community, or, you know, our paramedics that have to interact with individuals who might be at risk? I mean, do you have any information about that?
We've done a lot of work, if I'm understanding you right, James Michael, we've done a lot of work to educate our first responders and police officers and the sheriff's office actually about what they need to be doing as far as protecting themselves, which is the other reason why we're encouraging people to use face coverings, because we should assume there's everywhere we go, we're being exposed, and just knowing if somebody's positive or not, because people are asymptomatic, and we've seen some cases of that actually, where other household members became infected from asymptomatic individuals, probably because they didn't leave the home ever. So it's quite possible it could have been someone else, but there are those asymptomatic positives. So we tell the first responder, we make sure we give them PPE.
Is there enough, do we have the capacity to test firefighters and medics who may have been exposed?
Yes.
Okay.
We have a system set up at Bryan, and Bryan has a quick test, but I'm getting a desperate call for more cartridges to run this particular test. But actually, we have a whole system set up, so they just go to the Bryan drive-through, and they have a priority testing, and we get the results back quickly now, sometimes within 12 hours for them.
They've also instituted a triage over the dispatch, so the dispatcher will ask when they receive a call for assistance if anyone in the home has COVID-like symptoms, or if anyone has been diagnosed with COVID. And so that's helpful as well. And yeah. We used to do that a long time ago.
I just had one more question, but I think that you're getting ready to talk about it. But do any other board members have any thoughts or questions or comments that they want to share or ask right now? Pat, I think you said you're going to talk about antibody testing a little bit.
They're still working on that, and I asked if they, and they're also at the Med Center, they're doing it, and they're working with this COVAX in New York. I'm not familiar with COVAX, but they're also working with them on discussing a vaccine as well. So once we get these results from the antibody testing that's been done in Omaha, I think we'll be able to see where we're at. That might be something we could think about doing here in Lincoln, you know, for another sample size. And I've already mentioned it to Chief Blymaster and Chief Orr about that, and Todd Duncan from the Sheriff's Office would be a good opportunity to just see. But the question still is, even if you have the antibody, is that an indicator of immunity? They don't know that yet. We're still learning. You know, one thing that's totally not related to antibody testing, I did want to mention to you, we've been using 16 of our public health nurses to do the contact tracing. I think a couple times you've probably seen where we got almost 100 cases, new COVID positive cases in a day. And we also brought on 11 of the Lincoln Public School nurses. They started this week. So they're helping us out when we're planning for the future and what our world is going to be like here as we move forward.
Awesome.
I have a question. First of all, thanks so much for your leadership, Pat. I was wondering, aside from issues around PPE, what do you feel are the biggest challenges faced by the department and our community in our response currently?
You know, I think the biggest challenge is to have, I know people, it's so hard to keep this physical distancing and not being able to do the things we normally do. It's surprising how much that's impacted us. And especially, you know, I worry about people that are alone and that, but I think the most important thing is for us to wear our face coverings when we're out and to be washing our hands and keeping that physical distance. I think that's going to allow us to keep going forward and to be safe where we are and kind of mitigate what can happen from the virus. So that's where I'm at right now, just trying to get that out there and get people face coverings that don't have them.
Thank you.
I hear some people don't want to wear face coverings, you know, and I can understand that, but it's not just about you, it's about protecting others. So I keep trying to explain that, but I know I've seen some things on national TV that were rather alarming about how strongly people feel. So fortunately, we haven't, you know, our community has just done such a great job, but we have to be realistic about how hard you can push down and the benefit of that. And somehow, right now, I think our biggest challenge is learning to live with this virus safely.
Are there places people can get face coverings if they need them?
Well, you know, that's what we're working on right now. We've tried to target the nonprofit organizations. Duncan's made thousands of them that we've given out already. So we'll continue.
There's a lot of options for people on the web to make their own. You can make some with just a pair of scissors. So they're pretty available.
Oh, you know, another thing that has come up that you would be interested in, there's so much, is that the increased number of people having to go to the food bank and needing food. So we did work to bring the National Guard in to help Center for People in Need with food distribution. But I think that's something that we'll be hearing more about. That's a big concern. Lincoln Public Schools is still feeding students but I'm not sure how their summer program is going to be right now.
It is said that they will be ending towards the end of May. They'll stop feeding the kids.
Oh, wow.
So that's coming up pretty soon. Yeah.
That really worries me.
Mhm.
Is that because they're gonna run out of food?
That's when the schools will be closing. So once the schools are closed, they'll stop feeding them lunches.
Read the summer food program though.
Well, yeah, and Katie, we're trying to find out about the summer food program. It could look different.
Mhm.
That's something we're gonna have to follow up on. Again, I was hoping the schools could continue for a while. Because I know the food bank's been really stretched to get food out, so. We still keep in contact with the child cares, not still, we are keeping in contact with the child cares to help them. We get a lot of calls from businesses with questions about what they can do or how much they can do. And so we try to provide that guidance. Scott's team is doing that, which we're just really fortunate that we have such highly trained staff here that can really do things. That's been a blessing.
Are there?
Go ahead.
Go ahead. No, go ahead, Tom.
I was going to ask, do you know anything about when the National Guard will be done helping the food bank? Because I had something, they'll be done helping out soon at the food bank.
I think Chris will get in touch with us to let us know. I think we can get that extended. That's my understanding, Tom.
The food bank or at the food bank, Tom, or at the Center for People in Need? Oh, at the food bank.
I had heard
We
something
can
about the
check.
food bank.
Yeah.
Okay.
Now that you're saying that, yes, we'll have to check in with Scott again.
Yeah.
Any other board members have any thoughts or questions or comments that they want to share? Pat and Scott, one last question that I do have is there anything that you need from this board? Is there anything that you need from people here in order to be supportive? How can we as a team here help you all out?
Well, I think you do it all the time when we call upon you to ask you questions and do things. And I think there'll be other opportunities if we keep going forward that we'll need your assistance on. And it could be that there's going to be measures that come up that we're going to need the Board of Health to support, to vote on and support as we make decisions that are right for our community.
Awesome. I think I don't like to speak for everyone, but I think that I will speak for everyone when I say that, we're here to support you. And if there's anything that you need from any of us, please reach out anytime and just let us know.
Okay, will do.
Thank you so much.
I appreciate that. Even though I don't see you as often the same way, but I know you're there. Thank you.
All right. Any other last minute, any more final questions for Pat or Scott? One question that I do have while I have everyone here is just wanted to kind of get a feeling on as the June meeting rolls around, if we wanted to plan on meeting in June virtually. Would we like to take a vote now, or would we like to do a straw poll maybe in 2 weeks to kind of see where things are at? What do you all think?
I think maybe we see where it goes. That'd be good with me.
Yeah.
Okay. So what I'm hearing from the group. Okay. I think my internet got kind of wonky there for a minute. So just to make sure that I understand, I'll reach out to everyone in about 2 weeks from now, and then we'll just do a kind of a straw poll to figure out if we want to meet virtually for the month of June then. Okay, I'll be sure to do that. All right.
Great.
Seeing no further questions or no further comments? Oh, I'm sorry, Scott, what's that?
Nothing. I said that sounds great.
Okay.
He said that sounds
Seeing no
great.
further questions or comments, perfect. Seeing no further questions or comments, I would ask for a motion to adjourn.
So moved.
So moved, Dustin.
So moved.
Second.
Motion by Dr.
Yeah.
Seconded by Dr. Miller. Angel, can we do a roll call vote, please?
Dr. Garcia,
Yes.
Dr. Miller, Ms. Kingsley,
Yes.
Yes.
Ms. Randa, Ms. Jarrett,
Yes.
Ms. Bleicher,
Yes.
Mr. Bowers.
Yes.
Yes.
Yeah.
Yes.
Something is wonky with the bandwidth or something on the Zoom.
I think
Yeah.
so.
Voices
Now.
are going with different people. I don't know if you noticed.
Really cool.
I don't know how that happened, but
It's
wow.
haunted.
We were just really tired.